Mumps is a viral infection that primarily affects the parotid glands. Parotid gland is one of 3 pairs of saliva-producing glands, situated below and in front of your ears. The virus that causes mumps is known as a parmexovirus. In the absence of immunization, mumps usually occurs in childhood. Symptoms of mumps are often mild. In fact, many people who get mumps are not even aware that they are infected. Symptoms do not appear immediately. Instead, they usually occur from 16 to 25 days after infection. The classic sign of mumps is the painful swelling of the salivary glands, just below the ear. This swelling, known as parotitis, can occur on one or both sides of the face. However, fewer than half of those who become infected with the mumps virus have this symptom. For those who do have symptoms, these may include loss of appetite, fever, muscle aches, and fatigue. For those who have parotitis, these other symptoms will show up and last a few days before the person has any swelling. A common complication in older boys is orchitis, or inflammation of the testicles, but this rarely results in sterility. Once the mumps virus is in the upper respiratory tract, it spreads from the infected person to others through contact with saliva or respiratory secretions. Mumps may also be contracted by coming into contact with objects such as toys or drinking cups that have been infected by the sick person. Anyone who is diagnosed with mumps should be excluded from school or childcare, and should minimize contact with others for 9 days after his gland begin to swell, which is the contagious period. The doctor can usually diagnose mumps based on the swollen salivary glands. If the glands are not swollen and the doctor suspects mumps, based on other symptoms, he will perform a virus culture. A culture is done by swabbing the inside of the cheek or throat. The swab collects mucus and cells and is sent to a lab to be tested for the mumps virus. There is no treatment for mumps. The disease must be allowed to run its course. Treatment focuses on treating symptoms to make the person as comfortable as possible. Treatment includes the following steps. Drink plenty of fluids. If the glands are swollen and causing discomfort, ice or heat packs can help decrease pain. Non-aspirin medications such as acetaminophen and ibuprofen can be used to bring a fever under control and help with pain from swollen glands. Mumps is usually a mild disease. Serious complications, including meningitis, encephalitis, or permanent deafness, can occur, though this usually happens in adolescent and adult patients. Call your child's pediatrician right away if your child has a high fever, stiff neck, severe headaches, or signs of confusion. Do not give your child aspirin. Children with viruses, such as mumps, who take aspirin, can develop Ray's syndrome, a dangerous disease that causes liver failure, swelling of the brain, and even death. Mumps is a highly preventable disease because of the effectiveness of the MMR vaccine. Children are usually vaccinated against mumps between 12 and 15 months of age, and then again between the ages of 4 and 6. Mumps is considered a rare disease, with only a few hundred cases each year in the United States. Still, outbreaks occur in the United States on a regular basis, especially in places where there is close human contact, such as schools and dormitories. Therefore, it is important that your child be vaccinated to reduce his risk of contracting the disease.